American people owe at least $220 billion in medical debt, with an estimated 1 in 12 American adults owing money. Take a listen to some of the issues people are facing.
I remember seeing a bill for $20,000 and it kind of, knocked you off your feet, knowing you had insurance and not expecting to incur those kinds of things.
Unfortunately, like millions of other people, a $1,000 unexpected bill was not something I could afford.
They're suing us for not paying, right? But they're also suing my husband. My husband never got services there. So they threatened that they could take our land, and that they would garnish his wages if we didn't pay.
When my daughter was first diagnosed, we were facing an unknown volume of debt. It turns out that Aspen's total cost of care was over $1 million.
And in so many of those cases, health insurance companies would not pay. Joining us now is the former Vice President of Corporate Communications at Cigna, Wendell Potter. He left that position after becoming disillusioned by America's healthcare system and is now a vocal critic of it. Wendell, it's great to have you here. You walked away from your job after what you call a crisis of conscience when a 17-year-old girl died because her coverage was delayed. What happened exactly?
Well, that's right. And it was just an example that caught the media's attention at the time, but made it a very big PR problem for my company. And I was responsible for handling the fallout from that. Madeline Sarkeesian was 17 years old, needed a liver transplant, but a Cigna medical director said he didn't think it was medically necessary for her. He delayed that transplant for days and days. Cigna, because of the bad publicity, eventually agreed to pay for it. But by this time, she had gotten sicker and just died a few hours after Cigna agreed to pay for her transplant. That happened, that was in 2007. Since then, these companies are using what's referred to as prior authorization much more aggressively than they were back then. I knew that people were not getting the care that they need. People were dying prematurely. They were suffering in pain. I now write a newsletter called Healthcare Uncovered. We recently did a story about a woman in Illinois who battled an Aetna plan for 8 months to get coverage for pain relief. She has rheumatoid arthritis and was in debilitating pain. These stories are common.
Yeah.
And I think this pouring of rage is what you're seeing. More and more people are experiencing this.
Yeah, and you make the point that delay is a tactic. And delay can be deadly. In other words, just keep kicking the can down the road. Again, that's the title of that book. That was what was written on the bullets. But this is a common practice as well, and a real one.
It is. It is a common practice. It's one of the barriers these companies have erected to enable them to enrich their shareholders even more. Referencing that investor day that United was holding the day of the murder. That is the stakeholder that is most important to these companies, the shareholder and Wall Street financial analyst.
Yeah,
and the other
hang on that, because you wrote an editorial today, and I want to read, because you're referencing it. You read in that editorial, restricting patients' access to needed care made UnitedHealth, Cigna, and a handful of other big insurers Wall Street darlings, and made lots of people lots of money while doing little to enhance care. You go on to say that at these investor conferences, the one where Brian Thompson was attending and he was supposed to speak, the word patient is rarely, if ever, mentioned, while profit margin and shareholder value are uttered frequently.
Exactly. That's exactly right. I saw that throughout my career and working with the other C-suite executives. It's all about how can you reward shareholders and what you have to do that is detrimental to the people who enroll in your health plans. You were talking about medical debt. That's another barrier that they've erected. And one of the other reasons I left is because I knew that these companies and the health plans are pushing us all into. They have high deductibles. They make us pay hundreds and sometimes thousands of dollars out of our own pockets before they will cover a dime worth of our care. That's why we have $220 billion of medical debt, why 100 million of us have medical debt, and the vast majority of those people have health insurance. It's just not adequate. It doesn't cover what it used to, and people are facing delays even when insurance companies are supposedly going to give us access to care. They delay and often deny it when it should be approved readily.
Yeah, and we should, medical bills are the #1 cause of personal bankruptcy in this country. It is, and we have an astronomical number of them happening right now.
Yes, it's true. There are medical bankruptcies every single day. The Biden administration and Congress have talked about doing something about it, have done something. But Joe Rogan is exactly right. So is Elizabeth Warren. The one thing that hopefully will come of this tragedy is more focus by policymakers and the public and employers to force changes on this industry. That's what I testified about when I became a whistleblower in 2009, what I continue to talk about. We've got to continue. We can't let this just dissipate.
Yeah.
This has to be channeled in some ways that can have to do some good.
Worth pointing out that UnitedHealthcare is the 4th largest company in America. Its stock price has gone up more than 2,000% in the last decade. Thanks so much for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.